Hi, everybody. This is Dr. Eli Camp, and welcome to Vital Wisdom. I have a special guest today, Dr. Kathy Boyls, and we're going to hear from her in a minute. But first, I want to remind everybody what we're talking about on Vital Wisdom, and that is this idea, this belief, this paradigm of medicine that the body has the ability to heal itself, like every other organism on our planet. And there's some very simple rules, which if we follow them, this healing happens. And that is that you have to give the body what it needs to thrive. You have to remove what's poisoning it or presenting obstacles to healing and cure. And you have to stimulate that built-in innate healing ability that the body has. These three rules, if you follow them, then you get a body that will start to heal itself. And it happens every time without fail, because that's how we're built. That's how we're designed. Now, in this world of medicine, we have lots and lots and lots of different kinds of practitioners. And today, I'm so excited to bring and talk with Dr. Kathy Boyls, who is an MD who has discovered more to the paradigm than she learned, I think, when she went to medical school many years ago. And so thank you for being here, Dr. Boyls, and tell our audience a little bit about yourself.
Sure. I am a pediatrician. I've been a pediatrician for 33 years in practice. Trained just traditionally in the allopathic world and was your typical general pediatrician until a few years ago when I saw things in my profession that were not good. That really surprised me, actually, because I just believed everything I was taught for so many years. I had no reason not to. And then I realized that there's actually more to the story than what I had learned in my training. So I think for me, it was really going through our situation with COVID that woke me up. I went through a very difficult time with my husband being in the hospital with COVID. He was on a ventilator for 45 days and in the hospital 3.5 months. And during that time, I had many awakenings. I saw the dark side of my profession. I saw that allopathic medicine wasn't doing any good, and there was something else that we needed. And so, fortunately, my husband survived, thank God. He is alive and well today, but it's really not thanks to my profession. So we had a lot of recovery to go through when he came out. And it was really other types of medicine that got him through that, got him back to health. And I saw that in allopathic medicine, we really don't have the answer to making your body better, healthy, so that you don't need to take that pharmaceutical drug day after day, month after month, year after year, just to keep you at some sort of baseline that is maybe without disease, but not really healthy. So, so that's been my journey, and I wanted to learn more about the other types of medicine, which are extremely helpful.
So you said something I'm going to ask you about as you went through this journey with your husband, and probably with a sinking heart watched your medicine that you'd had all these years sort of fail him, and I think in some instances even put him in greater danger than he would have been had you done nothing at all. And what did you think before that moment about like some of these other approaches to health? Like, I'm sure you saw before, mainstream media just crushed a lot of the holistic practitioners trying to help people, right? By saying, check your vitamin D levels, get out in the sun, consider vitamin A. I mean, there were so many holistic practitioners talking about how to deal with a viral condition that had nothing to do with experimental vaccines or even drugs that turned out to be detrimental to give, right? I wonder what you thought before, like,
Well, I've basically done a 180-degree turn. So
right.
I am literally the opposite of the way I used to be. So
Okay.
I'm from New England. I'm from Rhode Island, from a very intellectual part of the country. Uh, there were no naturopaths or chiropractors that I was ever aware of growing up. And I never came out of the box of allopathic medicine. Never. And I was very critical of those who were in another type of medicine. So for me to wake up, anyone can wake up, first of all. And that just tells you the gravity of the situation that I faced,
Hmm.
where I, actually had a firsthand observation of things that were happening that should never have happened,
Hmm.
and trying to figure out the underlying reason why those things were happening. It just opened my eyes to the fact that we are not trying to make people healthier in allopathic medicine. We are only trying to keep them in a state of take your pills every day and you'll be all right.
Hmm.
And that is not health.
Hmm.
Uh, and there are times, in emergency situations where allopathic medicine is very helpful. If
Yes.
you have, if you need to suture a wound, if you have an emergency, if you need something that is basically quite urgent. But when it comes to chronic disease and even handling infections like COVID, it's not necessarily the best thing. And if you have a body that is already not healthy, and you add on top of that a viral illness that is significant, um, you know, just the allopathic medicine it's not going to help.
Hmm. Hmm.
So
And we
I
you
mean,
saw that. We got to see that firsthand through COVID for sure. That, COVID was a wake up for a lot of people on so many levels, like, access to food and sustainability and supply chain and small business owners who were just getting by, every quarter, and shutting down their businesses threw them into spirals that many of them didn't get out of. And of course, medicine. We got to see firsthand that should there actually be a real pandemic, our infrastructure is not going to be able to handle it in any way, shape, or form. Our communications were not sufficient. Our facilities were not sufficient. Our movement of medicine, if that had been real medicine, was not sufficient, right? I mean, there definitely that revealed. Well, it was a great test of the emergency broadcast system, right? Which we didn't pass with flying. We didn't pass at all. And I have had so many physicians with personal stories like yours seek me out or find me. And I know many of my colleagues have too, to say, looking back now, you guys were talking about these very simple things that people could do that would have made a huge difference for them. Not everybody. I mean, some people who were already quite ill, they didn't stand a chance, really, right? But it wasn't just because it was COVID. They're also the kind of people who suffer from pneumonia and seasonal, flu. When seasonal flu comes about, these people don't do well in general. The sicker you are, the harder it is when infectious disease comes into your sphere to deal with that. And and now all of these practitioners, such as yourself, started asking different questions. right? You started asking the question, well, what is health and how do we get somebody healthy, instead of what symptoms do I use to diagnose disease and what drug do I use for those symptoms? They're completely different questions. And I agree with you. If I'm in an accident and my carotid artery is severed or nicked, get me to the closest allopathic hospital, please. I don't want to die. They're very good at preserving life in emergent situations, right? Very good about that. They're very good with medications like insulin for people who are type 1 diabetic, or people who have had their thyroid out who probably didn't need their thyroid out because that's reversible. But let's say people who've had their thyroid out, they have to have thyroid hormone. And allopathy and their medicines and their practitioners are really good at preserving life of people like that. So I completely agree with you. When it comes to chronic illness and many infectious illnesses, there's so many ways to assist our body, which is capable of healing itself from those things if we do the right things as people, if we eat the right food, we get exercise, we get sleep, we have community, we get the poisons out, right? Quit drinking microplastics, quit flooding the body with hormones, dyes, preservatives, and poison, right? Why doesn't food in the grocery store that has all these poisons in it and on it, why doesn't that have a label that says beware, buyer beware, where all the good healthy food, like, we've got it all backwards. We know why. We know.
Well, if we look at the allopathic model, and this is actually something I learned from Dr. Liz Mumper, who is another very awake pediatrician. The allopathic model does three things: name it, blame it, and tame it with a prescription. And everyone's gone to the doctor, we know that the visit is 7 to 10 minutes, 15 if you are lucky. And within that amount of time, the doctor has to do a full history, do diagnosis, and arrive at an appropriate therapy. So we're essentially name it, blame it, and tame it. And the only tools in the toolbox are pharmaceuticals. That is the toolbox, pharmaceuticals. If you're a hammer, everything's a nail, so you're just going to hit it. And that doesn't really cut it for you to actually get better. There is no deep dive. There is no finding out exactly how you feel. I know the times, even in allopathic medicine, that I've been the most successful have been when I have sat down and taken a 45-minute period of time and talked to the patient. And I remember thinking, I want to feel what this girl feels. I want to know it so well that I can basically almost feel in my body what she's going through, because on the difficult cases, that's what I've had. Insurance companies, from administration, you've got to see more people. You've got to get these, you've got to have shorter periods of time. You've got to solve these big problems in a shorter period of time. And it really is, it's not good. And that's why I want people to take charge of their health. Most people just go to the doctor. They just want to know, well, what is it and what can you give me for it? And oftentimes with chronic illness, it's not that simple. And if you are able to take charge of your own health and just decide, well, maybe I need to go take my child for stitches because they got this gaping open wound, but for their chronic asthma, maybe there's another solution that doesn't involve staying on pharmaceutical drugs day all the time. Mm-hmm. So there are other things out there, and I sympathize with people who are just seeing kind of stuck. on all of these meds and they can't get off of them because they're afraid to, but they don't really understand them. But I do encourage people to just start learning, start exploring, start saying, well, maybe I can go read about this or talk to another person, talk to a different type of practitioner who has some other kinds of ideas for a different approach so that actually my body can start to get well and I won't need that pharmaceutical next year at this time, you know?
Mm-hmm. Mm-hmm. Well, this was the basis of naturopathic training. And I know you recently went through training for becoming a functional medicine practitioner. So that was I'm sure, key to your training as functional medicine.
Yeah, what we do is try to look at the root cause of the problem. So I'm training through MAPS, which is the Medical Academy of Pediatric Special Needs. And so we are looking at what is the root cause? Is it the cell danger response? Is it, that's causing all of this inflammation and all of this problem in neurobehavioral problems? And, because for serious problems like autism, there is not a good answer in allopathic medicine. I mean, you can go to lots and lots of therapy and ABA, and the child still may not be verbal and grow up to be a normal adult, but there are other things that we can do to actually help them get better. And I want people to know that they need to seek out other ways of doing it.
Mm-hmm. And that they're not, so for those of you who may not know, I've been in practice about 24 years, and the bulk of my practice was working with people on the spectrum. And I worked, that was maybe 75% of my practice, and 25% was just general family medicine and all of that. And in my early years, my very first patients who were on the spectrum came to me. I had no idea. I thought I had no idea what to do with them. And I would call my mentors and I would say, I don't know what to do with this kiddo. Like, he's broken, and I can tell you what he got broken from, because of course I took a good case and I had video footage of before and after certain procedures, and I have to be very careful or they don't let my videos on YouTube. But you all follow me and you know what I'm talking about, those 42 billion shots that we give little people. But what I discovered is that the same rules apply to folks on the spectrum as to every human. If they're eating the right food and they're avoiding foods that cause inflammation, and they have the right minerals and supplements and the right kind of environment, and we stimulate healing in the body and the neurological system and the cellular communication systems and things like this, giving their body what it needs, they start to heal. And we add on top of that homeopathic remedies, which is my area of specialty, which my audience knows. There isn't another therapy that I have found in all of those years. And, I went back to school late, in my late 30s. So I had a whole life of allopathy and that paradigm of medicine of, oh, go see the doctor. And my family was military. So we were even more in, we were more restricted even than people not in the military, because you just had to do what they said. And none of it made sense to me. None of it made sense. I wanted to know why that's happening, and nobody could tell me why. All they could say was, well, these symptoms call for this drug, right? And my brain worked differently than that. My brain said, but why did that happen? But it's not mysterious. It's not like some, energetic hand from the universe came down, touched the top of my head, and boom, that thing happened. How did that happen? And I had to go to medical school to figure out physiology and pathology and anatomy to understand how the body was put together and how it works. And in the course of that, lo and behold, thankfully it was naturopathic school. So I didn't just learn how to figure out what was broken. We had to start with what's healthy. what does a healthy body look like, and what do you need, what does the human need to be in its healthiest state? That's where we started. And then we moved on to what breaks and how it breaks.
Well, I know exactly where allopathic education goes wrong now. I in our first year of medical school, we're learning all the normal stuff. We're learning all the anatomy and physiology and biochemistry and microbiology. And then, and that's great. And we have a fabulous education in that.
Yes.
When we go to our second year in medical school, our big course is pathology. So that's where we learn about all the diseases that affect mankind, right? And along with that course is another one that we take simultaneously, and that is called pharmacology.
Yes.
And at that point in time, we have this sort of lock and key fit together of pathology, and here's the pharma answer. There is not a course in actually healing, in getting better, staying healthy, nutrition, something like that. We learned, okay, here's the RDA for vitamin C so you don't get scurvy, so
Right.
that's how much you need. But that's not really it. Do you want to have, we don't do that in any other area of life. Do you want to have enough money so that you can just make it barely get by? And that's it. And that's kind of where that RDA comes from. Or do you want to have enough so that you can live a little bit better and leave an inheritance for your children? Is that your goal? So you could stay at that point, but if you really want to know something more, it's not taught in traditional allopathic MD school. And so I think that is what's part of what's missing. I mean, what blew my mind was we went to a naturopath and chiropractor after Steve got out of the hospital on the recommendation of a friend of mine, because he was really, really in bad shape. And, when you've laid in a bed for 3.5 months, everything atrophies. And he had very swollen knees because when they would flip him prone and supine, they really messed up his knees. And he had no muscle mass. It was terrible. And so we kind of went to him like, well, what can you do for us? And we told him our story and everything he went through. And the naturopath was like, wow, I can't believe you're alive. I'm looking at you, but I really can't believe you're actually alive. And so he said, boy, I treated a lot of people in that, same period of time, hundreds and hundreds for COVID. And I said, well, how many of your patients died? And he said, none of them. And that just blew my allopathic mind. And I said, what? I said, they're dropping like flies in the ICU. What are you doing? I'm like, you're a naturopath and a chiropractor. What are you doing? And so he said, IV vitamin C. And I almost fell on my chair. That was like, you have got to be kidding me. Okay. My allopathic mind could not really process that very well. And so I had to say, hey, you know what? I need to learn something here.
Mm.
I'm missing something.
Good
I
on
need
you.
to learn this stuff.
Mm-hmm.
How is it that you can get someone better using something so simple, where we have all of these drugs and all of these procedures and all of this mechanical ventilation and they die. And
Mm-hmm.
then you do this very, very simple thing and they get better.
Mm-hmm.
And so it was very clear to me at that point that I needed to educate myself and learn what these other types of practitioners already knew.
Right.
And so that's been my journey in getting the education that I have. And now I do things differently.
Of
So,
course. When we know better, we do better, right?
yes, yes.
So I used vitamin C as well, but I also used vitamin D. because what I found is that the population of people in particular parts of our country, many of them, were vitamin D deficient. And we know that vitamin D blocks the receptor site for COVID. It did for other types of coronaviruses. And we've known this for 60 years that the vitamin D, right, that molecule, cholecalciferol, it binds in place of the coronavirus, which is why people who have sufficient levels of vitamin D have far fewer colds, seasonal colds. And so I used that in people that were deficient. And I used homeopathic remedy that the International Homeopathic, Doctors Without Borders discovered after we got enough data in from all the doctors using particular remedies. We figured out which ones could act in a prophylactic way and also treat. And then simple things like decrease sugar and get more sleep and wash your hands and do not isolate yourself. You have to stay within your community. I was prescribing secret parties for people. You need to commune with your folks for support and not be scared. Don't turn off the TV, turn off the radio, quit reading the newspaper, because they were building it into a frenzy that it didn't need to be.
No, and fear, unfortunately, fear drives a lot of allopathic medicine. And that's something that we have to resist, really, being afraid. And that's why so many people will start a medication, because they're afraid that if they don't, something bad will happen.
Yes.
And it is sort of this belief system, which allopathic medicine does not deserve that kind of belief system.
No.
So we've got to realize that God did put things in our body that will help us heal. And if we cooperate with that, we'll be much better off.
We will. You said you think you know where it goes wrong, and I agree with you, but I would step back one step from pathology. So, year one, our training in year one is almost identical. We use the same books, we have same hours between naturopaths and MDs and DOs in the biochemistry and physiology and anatomy and all that. But where we have an extra step before we hit pathology is in this getting to understand what the body looks like when you don't have the proper minerals and vitamins, and like not just the pathology, like scurvy is a pathology, but before we learn about scurvy, we learn about where the body uses its vitamin C and how much vitamin C it actually needs optimally. Not just, right, that whatever 500 milligrams a day to prevent scurvy. I don't even think it's that much. I think it's like 200.
No, it's pretty small. I mean, I think it's more like, it may even be less than 100. It's very, very small.
Really small. But our body uses so much more than that, especially if people are smokers. Every time somebody has a cigarette, man, they burn up 250 to 500 milligrams right there. And you breathe toxic air and you eat toxic food and your body has to process it. So I'm so glad you met that NDDC that could talk to you. And like, isn't it exciting when we learn something we didn't even know there was to learn? Like it wasn't even on your radar.
No, it definitely caught me by surprise. I was extremely allopathic,
Yeah.
and I didn't really make room for any other thing, and just thought it was all hocus pocus, and that wasn't anything I was interested in. So but it is very important that people understand that they do need to take charge of their health and
I agree.
and seek other things out. Just because a doctor tells you this is what you need, you can say, I appreciate your opinion. I will consider that. I'm looking at many different things now. we don't do that with anything else in life. We shouldn't do it with our health care.
Do you
We don't
think,
just go, okay,
right?
you will do it this way and that's it. And,
Yeah,
as Americans, we go, no, I'm going to figure it out.
yeah,
So we
yeah.
should do it in our health care. And that's so important, especially in the care of our children.
Oh, yeah.
And I really believe that the parents need to make decisions for their children. It shouldn't be the government. It shouldn't be the doctor.
No,
It should be the parent. And in order to make an informed decision, you have to have true informed consent, which means that you know both sides of the story, not one side that you're being pushed toward to do. You've got to have every aspect of the story, and then you make an informed decision. You may consult with many other people, but that's part of really learning and part of the community that you're talking about. And it's it's not good to be isolated, because
no.
then you can't share information and have that free exchange. Of course, we know that was a bit limited at that time as well, but we do need that free exchange of information. And you won't agree with everyone,
Right.
but you've got to at least have some understanding so you can make a good decision.
Well, we know that you can't introduce a new vaccine to market if there's already a treatment available for something. It's part of the law, right? They have to be able to prove that there is nothing that exists before a new vaccine can get approved for something. And there were so many things that we already knew about that could be used to treat a corona derivative virus.
Yes, and even in allopathic medicine with repurposed drugs. So that
Exactly.
is, there are a lot of doctors who spoke about that.
Many,
Um, but
thousands upon
just
thousands.
yeah, yeah, just understanding what is in something before you inject it into yourself
Oh,
uh,
yeah.
is very, very important. Uh, you shouldn't just take someone's word for it. Really have some understanding of it.
Right. Well, and like you said, people take charge. People have to take charge. And when we do that, when we find out things like what fuel does the human body run on? What does it thrive on? Right? I mean, it starts with food because we are food, let food be thy medicine. One of the oldest sayings from the early pages, the early history of medicine, because even way back, medicine was divided, way back between the main school of medicine and the sort of folk healers, right? Who would say, chew up this herb, you'll be fine. Versus let's make this pure and in the pharmacy, in the apothecary, right? We've always had this divide.
Well, Hippocrates said all disease starts in the gut, and that's where the
Exactly.
food
So
goes. And so,
food, the gut, the detoxification systems that our body has built into it that in today's day and age are being overloaded. And then, I don't know how many kids on the spectrum that have come your way. I would imagine as a pediatrician, did you not have lots of folks on the spectrum come through your practice?
well, yes, in the last decade, definitely. You see, when I went to medical school in the 1980s, I never heard the word autism.
Right.
And
Well, it was much rarer.
I did a pediatric residency, okay, for 3 years. Never heard the word autism. We had something called pervasive developmental disorder, but it was very, very rare.
Yes.
And there were 1 in 10,000 children had pervasive developmental disorder. Then we had an explosion of autism. Today,
1986.
yeah, exactly.
Uh-huh.
I love
Uh-huh.
that. So,
Yeah.
um, yeah, there were companies who were absolved from liability for their products. So, and then so now we are at 1 in 31 children and still rising. in the incidence of autism. It is dramatic. My practice 30 years ago looked very, very different than what, a typical pediatric practice looks like now. So, just in all honesty, I have a hard time just continuing in that type of practice. I had to be humble, flexible, and open-minded. When I saw the truth, I had to say, hey, maybe I've been wrong. Maybe this is actually not exactly right, and as I've read more recently, history of medicine, history of these diseases, history of vaccines, when you look at the facts, as I have been reading, there are times when I had to just stop and just take a breath because it just took my breath away reading that I was never taught this.
Mm-hmm.
Why was I never taught this? How are we where we are now? This is awful. And so it's just been an eye-opening experience. And I think every person, every doctor needs to come to that, aha moment and just look at the facts. Don't have any preconceived ideas. Even people who have trusted allopathic medicine all their life, just done whatever the doctor says, doctor's orders. My father was a doctor. That's the kind of, the Marcus Welby type of,
Mm-hmm.
and nowadays that is really not medicine. Unfortunately, medicine is protocol medicine nowadays. And I have taught residents for years, and I can tell you that residents will pull up a protocol and hit or click on sign and not know what it says in their orders.
Mm-hmm.
So at least when I was a resident, we had a blank piece of paper and a pen. And every order that I wrote had to come from here. Now, a robot could easily do this because you just pull up the appropriate protocol for whatever the disease is. You're not treating a person. Again, you're treating a disease.
Right.
So it doesn't matter if the last 25 people are totally different people, but they all have bacterial pneumonia. So you're going to do this. So you
Right.
pull up the protocol and you sign it, and that's it. But often they don't really even understand what they're signing because I've questioned them
No.
about it when I've taught them. So that is what people need to realize, is just this sort of blind faith in the doctor. The day for that is long gone. We have to take charge of our health, and we can't, not that you're not going to develop a relationship with a good doctor and trust them and have a conversation back and forth. But if you come across someone who is just obstinately saying, you just do what I say because I said it, that's not good. That
No.
should never happen.
No, I agree. Well, you know what naturopathic doctors have had to do because we have been very, very marginalized by the allopathic profession for exactly what you said. We're considered like woo-woo and out there and hocus pocus stuff. And because of that marginalization, what we've had to do is seek out allopathic practitioners, no, people who were trained in allopathy with allopathic credentials who are very open to what we do, which is assist the body in its healing. Quite simply, that is what we do. We assist the body in its self-healing, and we do that through setting the groundwork and giving the body what it needs, removing toxins, all of that stuff. And so what we've had to create is a referral network. So what I do so I'm licensed as a primary care physician in New Hampshire. I have full pharmaceutical scope. I have hospital admitting privileges, all of that stuff. But I don't live in New Hampshire. That's where I set up my practice, and it's where my license is. I live in Oklahoma where there isn't a licensing law, thank goodness. I have a lot of freedom here. But I have set up, like all of my other colleagues around the country, is a referral network. So if we need something that in an unlicensed state only an MD or a DO can order or can do, then we know who are friendly or who have woken up and they've stepped into this paradigm of medicine. They understand what we're doing and why we're doing it, and that our hands are tied in states where we're not licensed. In states where we're licensed, it's no problem. We can work side by side. But there, I tell all of my patients, you should have a healthcare team. I think everybody should have an MD or a DO on their team. I think everyone should have a naturopathic doctor on their team. It's very helpful to have a holistic nutritionist. You don't have to work with them. It doesn't cost a lot of money to work with them. It is something you do. You sit down, you have a consult, and maybe you meet with them quarterly to tweak it to make sure you're getting as much as you can nutritionally from your food. I think it's really good to have a physical medicine practitioner, whether it's chiropractor, massage therapist, traditional Chinese medicine, like this physical body work is very important. And sometimes we have to add, a mental health professional on board. It just depends on the patient. And I tell them, all of them, to have a good team like that, one means that you have multiple opinions. It's not just from one perspective, it's from different walks of medicine, from different kinds of practitioners who have spent a lot of time with you. And what are the results of that? My folks who have put together a healthcare team, their health is heads and shoulders above people who pick a single practitioner. So there's another part to this, which is unfortunate on one hand and fortunate on the other hand, and that is this idea of insurance. So I don't take insurance because the insurance companies dictate to me how much time I can spend with the patient and what I can do for them therapeutically. Yes. Like they know what's best for my patient. So I've had to move into, well, for my whole career, except for the first few years when I was in New Hampshire, I've had to move into a cash-based model, pay as you go. Now, health savings plans will pay for services and things like that, but I'm not covered. I won't become a provider, even if Oklahoma gets licensed. I won't do it because they tie my hands. How about your practice?
Well, I have started a practice, I actually launched it March the 1st, called Freedom Pediatrics. And in my practice, I don't take insurance for that very reason, because I want to be able to spend an hour and sometimes more with the patient and really do a deep dive and then get to the root cause of the problem and treat it from there. So it's not just a pharmaceutical. I'm just not in the 7 to 10 minute visit, name it, blame it, and tame it with a prescription. That's not what we're looking for. We're looking for actual lasting improvement that doesn't depend on taking a pill all the time. So
healing. You're talking about healing. You're interested in healing. Yes.
So I'm trying, there's not a way to do that in the insurance model. And the insurance model was based on allopathic medicine. And I can tell you that even within allopathic medicine, we get denials all the time. And sometimes the same insurance company that paid for something last month will not pay for it this month. So then the prescription has to be changed to something else. And it's a game. It's a game. And then they do not, I can tell you, want to pay the doctor. We are the last man on the totem pole, because their obligation is to their stockholders. They have maybe some obligation to the patient, and then really zero obligation to the doctor, because they'll just deny claims and you won't get paid. And it is a horrible situation that we've gotten ourselves into in this country. So I would encourage people to kind of get out of that model. I have a direct patient care practice in Freedom Pediatrics. So my patients can directly contact me. There's not an office person or a nurse practitioner, a nurse in between or anything like that. It's just direct
Me
contact.
too. Yeah,
And
me too.
so, yeah. And so, when we're working on things, if they have a question, it's easy for them to send it to me. It is a totally different model. And so mine is a subscription basis. So it's a monthly subscription where
Mhm.
they subscribe, and that's all my services. I'm also a lactation consultant. So I do lactation as well, and I've helped tons of women to breastfeed for decades. So
Right. Which is one of the most natural things we do with our babies, right? But
yeah,
they've developed an entire formula industry. This big box, man, this baby food, when we make the baby food ourselves, we make the baby food. There's even herbs that help your milk come in, and there's all kinds of wonderful things. So, I've often thought that if each state, because right now the state does a lot of its own regulation for doctors, if each state actually had a program, I don't, I don't want to throw out terms like socialized and nationalized and all that stuff, but doctors ought to be compensated, and people ought to be able to see doctors for as long as they need to see them per visit to be fixed and healthy. And doctors ought to be able to prescribe what that person actually needs. Do they need time off work? Do they need time to go and get in the fresh air and exercise their body? Do they need to buy certain kinds of foods? Do they need certain kinds of supplements? Do they need out of the box testing that allopaths don't even recognize
that's right.
as
That's right.
valid tests, which is insane because
Yeah.
some of the tests allopaths do don't even actually tell you anything that guide treatment. Right?
No, it
Oh,
doesn't. It's very reactive. So the problem has already gone down the ways a bit, and then it's
yes.
a reactive thing. I think kidney failure is a big example of that, because what does allopathic medicine do for kidney failure? Well, we're just going to watch your labs, and as your creatinine deteriorates and everything's getting worse, then you reach a point where now it's time for dialysis. So
It
we kind of
blows
watch this
my
thing
mind.
happen. Yeah, we watch it. We just watch this thing happen, and then when it gets to this point, we come in with some treatment that is just like sort of
Keeps you from
going to make
dying.
you live a little longer. But if you dial it way back and you say, hey, there's a problem here, maybe we need to do something to support the endocalyx of your arteries in your kidneys, or we need to help with repair, we need to help with just maybe nitric oxide would help, just so many different things you could do that will actually improve the kidneys, and not just wait until it gets to that point where you need dialysis. So that's what allopathic medicine does, unfortunately.
Right.
And,
Right.
why don't we do something before you need a stent in your heart? Or, why can't we recover you from your ADHD and not have to just take an amphetamine all the time? Is there something that will actually help your brain to work the way that it's supposed to? And your behavior will change when your brain is healthier. But that doesn't happen. Here's an artificial means of making you better so you can get through the school day, and you take it every day. And typically we see them every 3 months, and they
Right.
get a refill on their amphetamines and make sure their blood pressure's okay, they're not losing weight, they can sleep, and that's it. Here's your refill, because that's all we have time to do in 7 to 10 minutes, and come back in 3 months. So that's the program.
Right.
That's not a good one.
No, no, it's not a good one. Not a good one at all. I agree with you. Well, I can't believe an hour has gone by already. That is absolutely crazy. We were talking, folks, before I hit record, we were talking about how long we talk. And I'm like, well, sometimes it's 30 minutes, sometimes it's 45, sometimes we get to the end of the hour. And I'm like, did an hour go by already? This was definitely one of those calls. I really want to thank you for being here, Dr. Boyls, and talking about your experiences and your journey. I think you and I are walking in the same paradigm of medicine. And if we had met 10 years ago, you probably would have looked at me and made the sign of the cross and been like, just stay over there on the other side of the room. And I look
It took
forward
a
to,
lot to wake me up. I was stubbornly, I mean, again, I'm from the Northeast, and that's
yes,
not something that we think about.
no, no. And when I was in New Hampshire, when I set up my first practice in New Hampshire, naturopathic doctors have been licensed there a long time. And so the healthcare providers in New Hampshire have at least learned to tolerate naturopathic doctors. I don't know how accepting they are. And one time, I have to tell you this, one time I was working with a patient who was having problems with their sodium potassium balance in their body. And I called up the MD because I wanted to talk to her. I had some ideas and I wanted to run them by her. And she gave me such a hard time that I went in onto my bookshelf and I ripped out pages from my physiology textbook from school and I faxed them over to her because I was trying to explain to her the sodium potassium channels. And I faxed them to her office with a note and I said, did you even read this chapter in medical school? Which did not make us the best of friends. But she did call me back to say, okay, tell me what it is that you're thinking about doing with this patient. But to have to go to those extremes, right? What was so silly. But well, we're going to wrap this up, but I wonder if you have some words of wisdom that you would like to share with our audience who's listening to us.
Well, I think just a couple of things. One is really take charge of your health. Don't just trust someone. You can find people that are trustworthy. And then, secondly, for parents, just make sure that you are always informed on both the risk and the benefit of any therapy or any treatment at all. It is so important. And whether there are alternatives that work well. Sometimes alternatives aren't enough, but there are times when they may be. And so that's something for you to seek out because unfortunately, your allopathic doctor may not always tell you about them. So, and then just if they are interested, I am here in Oklahoma. So, freedompeds.com. And that's how people can contact me.
Excellent. Well, we'll have all that information in the show notes, folks. Thank you so much for being here. Thank you for walking down this path and exploring a part of the universe in which there are hundreds of thousands, if not millions of people who know that the body has the ability to heal itself, that there is another way other than the sort of mainstream dogma of take this pill, that there's so much more that can be done. I hope y'all have a great week, and thank you again for being with us, Dr. Boyls.
Thank you.
Thanks for joining me today. For those of you who have written in, emailed, and are interested in my books and other offerings, I wrote The Unvaccinated Child as a resource guide for parents and caregivers to navigate childhood illnesses in a natural and healthy way. And while the intended group was the unvaccinated, it turns out it's an important resource for the vaccinated kids as well, since vaccines do not necessarily prevent illness. Smoke Rings is another book I wrote, and that's to help smokers support their health, regardless if they plan to quit or not. So for people who smoke, love a smoker, used to smoke, continue to smoke, This book helps you be your healthiest version. And when I say it is judgment-free, it is absolutely judgment-free. You're free to make the choices you make. I just like you to find better health while you make those choices. My most recent book, Homeopathy, A Foundational Approach, is really great for someone, whether they're a complete beginner or they've already been practicing homeopathy. It starts at the beginning and it guides the readers through the basics and on into first aid and acute practice, so you can start using homeopathy right away. That's the most important thing to me, is to get folks using homeopathy in their everyday life. My workshops and courses can be found at either ecampnd.com or longshadowsranch.net. Have a great week. Again, thanks for joining me and thanks for your support.